Hello everyone, my name is Aether. I'm a psychiatric mental health nurse practitioner, and on today's video we're gonna be discussing major depressive disorder, also known as MDD. However, in this video I'm going to break it down to simplify it in case you need further clarity for diagnosing or maybe for personal use, just to help guide your conversation when you meet a provider. In mental health, we do use our Bible of Psychiatry, which is DSM-5 Diagnostic Manual. So I would be using that summary for this video. It's this, I'll put this in the reference or in the chat below in case you'd like to purchase it, just to have something that is portable that you can carry around for reference. So major depressive disorder, it's considered when you experience 5 or more of the following symptoms we would be discussing within at least a 2-week period, with 1 or 2 of the symptoms being at least a depressed mood or loss of pleasure or interest in doing the things you used to like doing. Loss of interest, also known as anhedonia, is considered when maybe you used to like playing basketball, now you no longer enjoy going out to play basketball. So the things you used to love doing, you no longer find no pleasure in doing that. So the people around you or you can note the difference in functioning, right? Prior to this, you used to love this, and now I no longer enjoy it. So there is a significant change. Another thing to note when considering the diagnosis of depression is significant weight loss or weight gain, at least 5% of your body weight within a 1-month period. And it wasn't intentional. You didn't try to lose the weight or you didn't try to gain the weight, but you've gained at least 5% of your body weight or lost at least 5% of your body weight within a 1-month period. And also, with major depressive disorder, patients might experience eating too much or loss of appetite. So patients might overeat or undereat. So these are things and factors to note. Another symptom that might present is insomnia or hypersomnia. That means having difficulty sleeping, inability to fall asleep, and sleeping in excess, right? So if you notice there is a pattern with some of these symptoms, one, you're eating too much or you're eating too little, right? So there is a pattern going on with some of the symptoms. Another thing you might experience is fatigue, loss of energy, no motivation. I have no motivation to do things. That one ties in also with like the lack of pleasure. So is there no motivation, feeling tired, lack of energy? So these are also things to note. And then you have feelings of worthlessness, guilt, right? That's just feeling worthless, like maybe no one cares about me, or I amounted to nothing, I am of no good, or why did I do this, or it's because of me that this happened or that didn't happen. Like being very judgmental toward yourself, being too tough. Another thing is diminished ability to think or concentrate. So this is also important to note that lack of concentration also present in other mental health disorders like anxiety and ADHD. So be mindful when someone tells you I can't concentrate, it doesn't automatically mean ADD or anxiety, because this also presents with major depressive disorder. So lack of concentration, some patients might tell you I am having memory loss, I've been forgetful lately, I can't concentrate. So just note these symptoms that present with MDD. Another thing is suicidality, Some people that experience symptoms of depression may have thoughts of self-harm, right? So these are key things to note. Another symptom is psychomotor agitation or retardation. That's too much activity or too little activity. And then also rule out substance use. Did these symptoms present after these individuals started using substances? Then maybe it's not major depressive disorder. It could be a physiological effect of this, some of the symptoms that might present with substance use, right? So it is not depression, it is just symptoms associated with whatever substance the individual might be using. So it's always good to question about substance use before diagnosing MDD. Were they using substances after these symptoms presented for at least 2 weeks period of time, or were they using before they experienced the symptoms? This is very significant to note when making the diagnosis of MDD. Let's run them back. Depressed mood, diminished interest or pleasure in the things you used to like doing, significant weight loss or weight gain within a month period, and it wasn't intentional, or eating too much, eating too little, weight loss, weight gain, fatigue, loss of interest, low energy, diminished ability to think and concentrate, and suicidality, and some other things to note that patients will tell you: crying spells. Maybe recently they've been crying a lot. They isolate themselves, right? With a lack of pleasure or interest in doing things, you might just want to isolate yourself. You might just want to lay in bed all day. Don't feel like waking up, don't feel like getting up. So these are things to note. All right. So if you or someone are experiencing these symptoms, I would suggest you consider visiting a provider around your area to further assess you and see what could be going on. Thank you for watching. If you made it this far, please like the video, subscribe to the channel, and share your thoughts down below. And I'll see you on the next one.